Good health and welcome to today's edition of Ethnic Health America. I'm your host, Dr. Mike Lenoir. Today's program, we're going to talk about HIV disease in the context of a very special program. For those of you with foot problems, we're talking with a chiropractor. And finally, we're going to talk to a doctor who's visited Haiti right after the earthquake. Stay tuned. We'll be right back after this break. Welcome back to Ethnic Health America. In this segment, we're going to talk about HIV disease in the context of a very special program in Oakland, California. Our special guest, Ms. Jamila Shipp. She is the program coordinator for CalPep. Thank you for joining us.
Thank you.
Tell us what CalPep means.
CalPep is California Prostitutes Education Project, and we provide HIV prevention to high-risk populations, specifically African Americans and other minorities, such as youth, homeless, transient populations, substance users, ex-offenders in the community. We've been around for 25 years serving this population originally starting out as a prostitutes' rights education project. And we expanded to doing HIV prevention, care, and other services for various populations that needed it.
Now, is the emphasis on prostitutes still a part of the program?
It's not the total emphasis. We actually have moved away somewhat from prostitutes, but we recognize that's always going to be our home population. That's a population that we'll always serve. So we always do outreach to this population. We always have services and our doors are open to this population.
Let me ask you, there are a lot of people who think the HIV epidemic is over. You know what I mean? You don't see it on the news much. You don't see, people dying as much. And I have, having worked in news, recognize that they don't like to tell bad news. But there are populations where the HIV problem is still the same.
Yes, in the African American community, it is very prevalent. It's the number one disease for African Americans, women 25 to 44. It's the number one killer. And in Oakland, particularly since 1998, we're in a state of emergency for HIV. Women, even in this county as well as Oakland, are still becoming infected. I recently, just before I came here, tested a woman who just found out that her partner was infected, and he was just told her from jail. So there is just a lot of women in the African American community as well as the Latino community who are becoming infected. So this is a disease that's continually affecting this community.
As HIV risk factors, have they changed? I mean, obviously when it first started, it was a disease almost exclusively of IV drug users and male homosexuals.
It hasn't changed. Actually, most people are becoming infected through heterosexual contact, particularly women. They are becoming, they see that they're becoming infected, but they think that they're not infected. They think it's a disease of the gay man disease, or they think it's, like you said, a disease of drug users, but it's not.
How low is the down low?
It's low. I mean, there's no one standing on the corner saying, "Hello, I'm on the down low." They're everywhere. You don't, men come out of prison saying, they go straight back into their heterosexual lifestyles. There are men. We're doing a project called the Budgets Project at our agency where we're doing a study. But these men are doing things that no one wants to talk about. They don't talk about it with their partners. They don't talk about it with their, lovers or anyone else. They don't identify as that, and so it's a real issue. But people have to recognize it's an issue and protect themselves. You can't expect someone else to come out and just say, "Oh, I'm on the down low," because that's not going to happen. You need to take it into your own hands, especially women.
How's your agency structured? What resources do you have?
We have a youth program, a drop-in center called The Zone. That services youth between the ages of 12 and 30.
And you see quite a few?
And we see quite a few. We actually have a risk reduction program, case management program for HIV positive, and we see about 57 clients. And those are 57 who are actually on our caseload. Then we have just clients who come in and get services because we believe in not turning anyone away. And so then we also have our mobile testing. We have 2 mobile clinics that go into the community about 3 or 4 times a week and actually go into the community. And we have our staff outreach to to the population that are at high risk in various populations. In Oakland alone, we have 6 zip codes who are the highest in the state for HIV. We just actually did some research because we were trying to figure out how we can do more case finding on HIV cases, or finding when we do testing, how to find more positives so people know that their status, and stop the cycle of transmission.
Realizing that you have, you are not the medical person, but is it your sense that less people are dying from HIV disease and the drugs are better?
There's a lot more medication that is out there, so people are living a lot longer. People are dying actually from other diseases, heart disease, other things. They're living and having other normal diseases, that cancers and different things of that nature, that diabetes and things of that nature, that they're dying from because the medications are better and they're living a lot longer.
How much support do people need once they find out they're HIV positive?
I think they need a lot of support. It's, a lot of, we have mental health services on site, so we have a therapist that our clients can see, but because it's a lot to deal with, the medications might have side effects. They need someone to talk to about going to the doctor if they don't feel comfortable asking the right questions. Just being able to, eat right, and being able to have someone to talk to about just their day-to-day stuff. You definitely need support, and especially if you're not in a good place, if you already might have some home issues with homelessness or substance abuse, you definitely need a lot more support than maybe someone who's already functional and have a job and different things going on for themselves.
One of the things that we've always appreciated is that people are willing to kind of step out and take on problems that are really very, very difficult. Mm-hmm. I know that this work on HIV in the African American community doesn't always have the results we want. We're still the group that's the most impacted. Mm-hmm. But I would have to say that in the city of Oakland, your program, CalPEP in particular, have been very effective, in trying to identify and provide support services. But a lot more needs to be done, doesn't it?
It's still more people out there who need services that are not able to access services, and with the state and other funding sources being cut and services being cut, especially on the backs of the poor population who are being impacted by this disease, I think it's definitely needed to address this population even more.
Ms. Jamila Shipp, the program coordinator for CalPEP, thank you for joining us.
Thank you.
We'll be right back after this break.